Hi, my name is Cassidy Gillis, and I'm doing my presentation on smoking. I will be discussing the chemicals that are in a cigarette, the health risks that come with it, and why and how a smoker should quit.
Crush a bit, little bit, roll it up, take a hit, feeling like 2 a.m. summer night, I don't care, hand on the
Cigarette smoking harms nearly every organ in your body. It causes many diseases, reduces the overall health of a smoker, and reduces your life expectancy by roughly 10 years. These are only a few of the harmful facts that have to do with cigarette smoking and how it affects our everyday lives. If smoking is so harmful to the body, then why do people do it? Many people believe that smoking is a stress reliever, a craving, or even a cure. But smoking is really an addiction. It is the leading cause of death worldwide and is the biggest health risk anyone could be exposed to. A cigarette smoke is composed of many different chemicals, but the three main chemicals are tar, nicotine, and carbon monoxide. Tar is known as the black, sticky substance that is exposed when a cigarette is passed through a filter. It is an extremely toxic chemical and will damage a smoker's lung over a period of time. It will also yellow, blacken, and rot the teeth. Nicotine is the reason why smoking is considered an addiction. It is a chemical liquid placed in tobacco, which is absorbed through the wall lining of the lungs when it is smoked. It then enters the bloodstream and travels to the brain, which is where the addiction takes place. Once the nicotine stimulates the brain, it will rely on more nicotine to maintain normal brain function. Smokers often have nicotine withdrawals if they have not had a cigarette in a while or if they are under stress, which creates the continuous cycle of the smoking addiction. Carbon monoxide is a clear, odorless gas that essentially takes the place of oxygen. When it is inhaled, it is rapidly absorbed in the bloodstream, which decreases the blood's ability to carry oxygen. Evidently, this is not good, as the human body needs oxygen in order to stay alive. The left picture shows the comparison of a smoker's lung to a healthy lung. As you can see, the effects of smoking are significant. The smoker's lung has completely turned black due to the tar that is exposed from the cigarette. The right picture shows the difference between a smoker's teeth and a non-smoker's teeth. It is clear that smoking has a drastic effect on a person's oral hygiene. Smoking can cause and affect many different diseases that have to do with the heart, the lungs, the bones, the brain, and many other organs in the body. The three main diseases that are caused or affected by smoking cigarettes are lung cancer, COPD, which is chronic obstructive pulmonary disease, and heart disease. A few other diseases that have increased chances due to smoking are strokes, pneumonia, blindness, diabetes, reproductive complications, and many different types of cancers. There are many different ways to quit smoking. Some will work better than others, but it all depends on which one you can stick to and which approach suits you best. The top 3 ways to quit smoking are by quitting cold turkey, using a nicotine replacement, or attending cognitive behavior therapy. Quitting cold turkey means relying on yourself to quit smoking completely. This is the most popular approach to take when it comes to quitting, but it is also very difficult and people often switch to a different approach, which includes some outside support. Next to quitting cold turkey, using a nicotine replacement is the most common. Nicotine replacements come in many different forms and work by giving you nicotine without using actual tobacco. Some examples of nicotine replacements are patches, gum, inhalers, sprays, and e-cigarettes. Another way to quit smoking is by attending cognitive behavior therapy. You will work with a counselor to find ways not to smoke. Together, you guys will find certain negative thoughts and triggers and develop ways to deal with stress or urges. This approach will work mostly for people who really need the help and support.
Okay.
This animation will show the effects of smoking on the body. Click the navigation arrows below the animation screen to play, pause, rewind, or fast forward the animation. This animation contains sound. When you inhale smoke, it travels down your trachea and bronchi to your lungs. The bronchi branch and narrow into tubes called bronchioles. The bronchioles continue to branch and end with tiny air sacs called alveoli. When you smoke, over time, tar settles in your lungs and damages your alveoli. This makes your alveoli less stretchy, making it harder for your lungs to take in the oxygen you need. This can make you short of breath and feel tired. Smoking for a long time can lead to chronic obstructive pulmonary disease, or COPD for short. This term describes long-term conditions that affect the lungs, such as chronic bronchitis and emphysema, which cause breathing difficulties. Smoking can also have an effect on your heart. Carbon monoxide found in cigarette smoke binds to hemoglobin, a substance found in red blood cells that carries oxygen around your body. This prevents your cells from carrying a full load of oxygen around your body, making it harder to breathe and putting stress on your heart. Smoking damages your blood vessels, which affects how well your blood and therefore oxygen flows around your body. This makes your heart work harder and faster. Over the years, smoking causes fat deposits in your blood to build up on the walls of your arteries. This forms a plaque, which narrows and blocks blood vessels. This can lead to heart disease, stroke, and even a heart attack. If you smoke, you're more likely to store fat around your waist rather than around your hips. This is linked to a higher risk of developing type 2 diabetes, high blood pressure, and heart disease. Smoking affects your appearance. It can prematurely age your skin by between 10 and 20 years. Smoking stains your fingers and teeth. It also affects your sense of taste and smell. Smoking can also cause many types of cancer, including throat, mouth, lung, stomach, kidney, and bladder. Lung cancer is the cancer most commonly associated with smoking. This is the end of the animation. Click on the animation screen to watch it again.
In conclusion, smoking is a very big health risk in our everyday lives. It is the leading cause of death, which is a statistic that speaks for itself and proves how horrible smoking really is. The amount of chemicals in a cigarette are very toxic, and the health risks that come with smoking are extremely harmful to the body. There will be many challenges with the quitting process, but quitting smoking for good will be a great physical and mental accomplishment.